The way it's done is once you characterize, let's say, a particular policy, and that particular policy, all its various steps and interventions that you're envisioning, you then calculate the emission reductions that that particular policy is going to give you. Obviously, I say emission reductions because you're not going to enforce a policy that's going to increase emissions. And after you do that, then you use these relative risk functions that I mentioned, this association between exposure and effect on health, which not only covers mortality, which is what we've been talking so far, but also covers morbidity that usually is surrounded around respiratory diseases. So you have asthma attacks, chronic bronchitis. You also have days when your activities are restricted as a result of not feeling well. Perhaps you're going to work, but you're not providing your 100% concentration, so there's a productivity loss. So when a person is sick, that person has to probably take medication, may have to go to the doctor, worse yet, may have to go to an emergency room visit setting. So the costs associated with the medication, the cost associated with seeing a doctor, the cost associated with visiting an emergency room, and any health services that are associated to provide these services to the person who's ill get taken into account. In addition to the losses to a company who's hired you to do a job and has to hire somebody in your place as a result of you not being able to work that particular day, and that's the productivity losses. Together, this ensemble are called market costs. These costs are costs that are usually reflected in the transaction processes on the market. But in addition to that, when we're looking at mortality in particular, you also look at the welfare loss. People are going to be sick. They don't want to be sick, so they don't want to feel the pain and suffering. And so in order to do that, they would be willing to sort of pay for some policy that has a cost to their pocket that would allow them not to experience that particular pain and suffering. And these are welfare losses. These welfare losses are usually determined using surveys, for instance, where people are asked, well, how much would you be willing to pay in order not to have an asthma attack to yourself or perhaps your child or someone else in your family? So we add these costs together, both the market costs and the non-market or welfare costs, and that gives us a cost per case of asthma, for instance. So once we do our estimate of what the burden is, we then calculate what is the cost of that by multiplication. Now, in addition to these two, and this is very important in developing countries, sometimes somebody who's sick, maybe a family member who also is work may have to stay home. So then there are other costs, indirect costs that enter into the equation. Those would be folded in as well as part of this unit health cost, and then you multiply them. Now, generally, people use the term impact and burden as being equivalent, but they really mean something very specific in the field of air pollution. A burden is a characterization of what is the number of cases of a particular morbidity, a particular disease, or the number of people that die. And whereas an impact is the difference between two different trajectories, that one that is a business as usual, for instance, and the second one may be an intervention that you're trying to promote, and you want to see the difference between the two. The last thing perhaps I should mention is that oftentimes people say, well, how do you value mortality? And there's two ways in which you can value it. You can value it using the value of statistical life, or the value of a life year lost. The value of statistical life, as its name suggests, is sort of giving a value to a death. But it's not the value of a person's life. That, of course, has no value. It's an infinity. But it is the cost that society can afford to pay in order to protect a statistical death, some unknown person who's going to die as a result of being exposed to pollution. Whereas the value of a life year, as its name implies, it's the value of gaining or losing 1 year of your life. And that's derived using the life tables. And that's why we do both type of calculations. And oftentimes people will report the value of life year calculation as a lower bound because it's smaller, usually about a factor of 2 lower than the value based on the value of statistical life.